IUD. What is it? An IUD is a small T-shaped plastic and copper device that's put into your womb. It stops you getting pregnant and protects against pregnancy for between 5 and 10 years, depending on the type of coil fitted. It's sometimes called a coil or copper coil. What are the benefits of getting an IUD? An IUD is more than 99% effective. This means there is less than 1 in 100 chance of getting pregnant if you have an IUD in place. Once fitted, it lasts for 5 to 10 years, so can be a good contraception choice for people who find it difficult to remember to take a pill at the same time every day. Because it doesn't contain any hormones, there are no hormonal side effects. You can have it removed at any time, and your normal fertility will return very quickly. What are the possible side effects of getting an IUD? Some people find that their periods may be heavier or longer or more painful, although this may improve after the first few months. You will need a small procedure to have the IUD fitted, which some people find uncomfortable. Taking painkillers before and after the procedure may help ease discomfort. It doesn't protect against sexually transmitted infections, STIs, so you may need to use condoms as well. How is it fitted and removed? An IUD can be fitted at any time during your menstrual cycle, as long as you're not pregnant. You'll be protected against pregnancy straight away. Before your IUD is fitted, a doctor or nurse will check inside your vagina to check the position and the size of your womb. You will also be offered testing for sexually transmitted infections. Fitting the IUD should only take a few minutes. To fit an IUD, the vagina is held open, like it is during a smear test, and then the IUD is inserted through the cervix and into the womb. Having an IUD fitted can be uncomfortable. Taking painkillers before and after the fitting may help ease discomfort. Talk to your doctor or nurse before the fitting if you're worried about pain. Removing an IUD. Removing an IUD is a simple, quick procedure. It rarely causes much discomfort, even if the fitting was painful. Your IUD can be removed at any time by a trained doctor or nurse, and your fertility and periods will quickly return to normal. If you're not having another IUD put in, and you don't want to get pregnant, use additional contraception, like condoms for 7 days before you have it removed, or abstain from sex. You can also seek advice on another form of contraception if you don't want to become pregnant. Other important things to know. There's a very small chance of getting an infection in the first 20 days after the IUD has been inserted. This could lead to a pelvic infection if not treated, so it's important to seek medical advice if you get any symptoms like discharge that smells, pain, or a high temperature. It's not common, but the IUD can be pushed out by the womb, or it can move out of place. If this happens, it's usually soon after it's been fitted. You'll be taught by your doctor or nurse how to check that your IUD is in place. If you do become pregnant with an IUD in place, there's also a small increased risk of ectopic pregnancy, which is when a fertilized egg implants itself outside of the womb. However, you're still less likely to have an ectopic pregnancy while you're using an IUD than when you're not using any contraception. Where can I get an IUD fitted or removed? You can get the IUD for free, even if you're under 16 or have never been pregnant before, at your local sexual health service. Some GPs are able to fit and remove IUDs. Contact your GP surgery to ask if this is a service they can offer. If you have any worries about your IUD, call your GP or sexual health team who can provide advice.